Hi, everyone. Thanks for joining us. I'm Samantha.
And I'm Thomas.
And this is Trans IRL. We have a great show for you tonight. Our guest tonight will be Meir Abrams. Meir is a licensed clinical social worker, and we'll be talking to them about the state of trans healthcare here in the U.S.
Plus, our resident TV and film expert, Neela Karasik, will also be joining us. She'll be taking a look at a recent episode of NBC's medical drama, Chicago Med, which featured a trans character. That's coming up later in the show.
Yeah, but first we wanted to talk about some stuff that's been happening in the news this past week. It's been kind of a depressing week or so for the trans community in the news. 3 trans women of color were killed within 5 days of each other, and the Trump administration has proposed numerous policy changes that target the trans community.
We're going to talk about all of that tonight because we think it's really important that we cover it. That said, we hope everyone in the community is doing okay. And if you're not, we hope that you reach out to someone. Just know if you're having a hard time right now, you're definitely not alone. What's going on is not normal.
Yeah, with that, let's get into the news. This past week, the Trump administration ratcheted up its attacks on the trans community. The Department of Housing and Urban Development proposed a change that would allow federally funded homeless shelters to consider sex and gender identity when deciding whether to accommodate someone. The proposed changes come a day after HUD Secretary Ben Carson assured lawmakers at a House hearing that he had no plans to alter the 2012 Equal Access Rule. Listen to this clip here.
And can you assure this committee that you will not make that HUD does not have any current or future plans to eliminate the equal access rule in rulemaking?
I'm not going to say what we will do in the future about anything. We don't know what we're going to do in the future.
Are you currently anticipating doing that?
I'm not currently anticipating changing the rule.
According to the U.S. Transgender Survey, nearly 1 in 3 transgender adults will experience homelessness in their lifetime, and 1 in 8 were homeless in the last year.
Friday, the Department of Health and Human Services announced plans to roll back the Obama-era rule that protects transgender people from discrimination in healthcare. The rule expanded the Affordable Care Act's definition of sex discrimination to include gender identity. The Trump administration's proposed change would make it easier for doctors, hospitals, and insurance companies to deny care or coverage to transgender patients. To paint a picture for you, imagine you're hemorrhaging blood. You call 911, EMTs show up, and then they realize you're transgender. They refer to you as it and mock you instead of helping you. Imagine you're seriously injured in a car accident. Ambulance workers arrive, and when they realize you're trans, they outright refuse to treat you, mock you, and you die. Or imagine getting a cancer diagnosis and going to 20 separate doctors, each one refusing to treat you because you're transgender. The thing is, these are not made up scenarios. All of these are actual stories. All of these actually happen. One was a trans woman in Michigan, another was a trans woman in Washington, D.C., and the other was a trans man from Georgia. And we heard about these stories from our friend Sam Dillon Finch. He's an editor for the website Healthline. He had some really powerful tweets about this, and we're going to link to the entire thread in the video description. And one of the points he made was that when we say that these protections are a matter of life and death, we really literally mean that. These protections that the Trump administration wants to roll back, they also protect women who have had abortions. There will be a 60-day comment period, and we're in that now. So if you would like to make your voice heard, you can do so by going to protecttranshealth.org. We'll put a link to that in the video description as well. The ACLU has pledged to sue should the change be implemented, and 16 healthcare groups and doctors have already filed lawsuits.
All this comes as 3 transgender women of color were killed within 5 days of each other this month. The victims include 21-year-old Claire Legato from Cleveland, 23-year-old Malaysia Booker from Dallas, and 40-year-old Michelle Washington from Philadelphia. Police in Philadelphia and Cleveland have arrested suspects in each of these cases, but say they are not treating them as hate crimes. A total of 5 transgender people have already been killed this year, although it's very probable that that number is low due to misreporting.
If all of that news has you down, here are 3 positive things that have happened in the past week that show some progress is being made when it comes to trans rights.
The first one, on Saturday, the World Health Organization, or WHO, recategorized gender incongruence. It's no longer considered a mental disorder. It's being moved to the sexual health chapter. Keep in mind, oftentimes countries require transgender individuals to receive a diagnosis before they can change their name and gender marker and do other things. Now, the first step isn't being diagnosed with a mental disorder because the WHO doesn't consider being trans a mental issue anymore.
The second thing, on Tuesday, the Supreme Court declined to hear a case about transgender kids and bathrooms.
Yeah, they decided instead to leave lower courts' rulings in place that favor trans rights. So here's a really quick summary of the case. There's a school district in Pennsylvania. They believe that students should have the right to use the bathroom and locker room of the facilities that match their gender identity. They do require that students talk to a guidance counselor first. Well, what happened is a group of students in this school district sued because they said that their right to privacy was being violated because of this policy. Lower court declined to issue a preliminary injunction blocking the policy, and now the Supreme Court has declined to hear the case as well. So trans kids in that school district can continue to use the bathrooms that correspond with their gender identity.
I always knew I was different. I didn't know that there was a term for the type of person that I was.
And finally, last Thursday, the shaving company Gillette released this ad featuring a trans man named Samson being taught how to shave by his father. And of course, shaving for the first time can be such a huge rite of passage for many men. And what's really great about this ad is that it's so raw and it just so beautifully captures this moment between father and son. So kudos to Gillette and congrats, Samson. When we checked this morning, the ad had been viewed 1.3 million times, had nearly 4,000 comments and more than 9,000 reshares.
All right, now that we've discussed all the recent news, we have the perfect guest joining us here tonight to help us discuss it all.
That's right. Tonight's guest, Meir Abrams, is a licensed clinical social worker and advocate on the front lines of trans healthcare. We are so excited to welcome Meir to the show. Hi, Meir.
Hey, everyone.
Hey. Hi, Meir. Thanks so much for coming on the show here tonight. We're so grateful to have you on in this moment to help us process all the news that's been thrown at us lately. But first, would you take a few moments to introduce yourself to the audience?
Absolutely. So I'm Meir Abrams. My pronouns are they and them, and I'm a writer, a researcher, an educator, an activist, and a therapist who specializes in gender and transgender health. Some projects that I'm working on right now are research sponsored by the National Institutes of Health, capturing the long-term effects of puberty blockers and hormones for trans and non-binary youth, a mentoring program that matches trans and non-binary youth with similarly identified and experienced trans adults, a project about LGBTQ fertility, and a pair of books, one for youth and one for parents and professionals, about puberty, identity, sexual health, and gender health. When I'm not working, I live in California with my wife, Nola, and dog, Igby, and you can find me by the pool, on an outdoor adventure, at a concert, or chasing sunset. I identify as human, but some of the other labels that I use to describe myself are trans, non-binary, and queer.
That's so great. And congrats on your recent wedding. I saw the pictures. They were like so beautiful. So congrats.
Thank you. It was a special time for sure.
Definitely. Meir, I think a good place for us to sort of jump in is for you to give us a bit more context on your background and on your life. You know, what was your coming to gender moment or series of moments? What was that like? And how did you find yourself doing the work that you do today?
It's a great place to start. So I grew up in St. Louis, Missouri in the 1990s, in an environment and a home that had pretty traditional beliefs about gender. I didn't know any LGBTQ people growing up, and sexual orientation and gender were really only talked about and mentioned as they related to more heteronormative stereotypes. So because everyone around me referred to me as a girl and told me I was a girl, that's what I thought I was for a long time. We all believed that genitals determined gender then. I didn't think there were any other options. But as long as I can remember, I gravitated towards a presentation and activities that people around me typically associated with boys. Though I don't recall a specific moment in early childhood, I do remember being about 7 or 8 years old and realizing that being a tomboy allowed me to do things that the other girls couldn't do. Being a tomboy was really my bridge across gender barriers. I stayed on the boys' soccer team long after most girls and wore my brother's boxers and underwear well into the 3rd grade. I really idolized my brother and the way he was able to be seen in the world. I would force him to play male model with me and dress him up in all the clothes that I really wanted to wear. So that was one way of expressing my interest in my masculinity as a kid without really having to cause attention to myself. So in a way, I don't really see myself as having a coming to gender moment. I kind of see my life as a gender evolution. I've always been who I am, and part of being human is constantly changing and evolving. And for me, there's really no before and after. There's just growth and development. So that's kind of how I see my journey and some of my early coming to gender moments.
Yeah. I connected a lot with what you were saying about the tomboyness of being a little kid. I mean, that like so categorizes my entire childhood. Like everybody in my family very openly like accepted me as the tomboy, and like you're right, it allowed me to explore my gender in that way. And of course, it's a privilege to have access to the safety of masculinity, because I think in the reverse, things aren't as easy, right? You know, trying to embrace femininity is often demonized, but there was this safety in masculinity where people don't demonize it as much, and I was able to explore that under the cover of tomboyness, and get to really you know, seek out the gender things that I was lacking in my childhood. And I totally did the thing where my cousins, I would like do their hair for them. Like I didn't know how to ask for like a short haircut. So I would like hairstyle like their hair like so often, like I probably to the point of annoyance. My boy cousins, I would just like always want to do their hair, and it was a whole thing.
Yeah, I'm glad I wasn't alone there. I think that like I thought my brother probably thought it was pretty weird, but now I know that, you know, it was just a safe way to express masculinity in an environment where, you know, folks who were assigned female at birth really were limited in how they were able to express themselves. So
yeah.
So, Meir, what I'd like to do is start digging into the state of trans healthcare here in the U.S. But maybe to start the discussion, you can lay out for the audience what the general landscape of trans healthcare was prior to these most recent announcements.
Yeah, absolutely. So we've seen more progress in the field and increased access to trans healthcare in the past 10 years, more so than really ever before. And we've moved from a place of a diagnosis of gender identity disorder to gender dysphoria. And that was a really big move because it really shifted the focus of the quote unquote disorder to the distress that trans people feel as a result of their environment or their relationship with their body. It's nothing inherent in the transgender identity that is actually related to mental health. So that was a huge shift that we saw in the last 10 years of trans healthcare. And then more and more medical and mental health organizations are receiving training and education on gender diversity and gender affirming care. And despite the political climate, those in the field are really working harder than ever to increase gender sensitivity and literacy across all realms of healthcare, not just in gender clinics or with providers who specialize in trans health and prescribe hormones or do surgeries, because trans people are human. And like anyone else, we need to go to the emergency room every now and again. We need to go see specialists who may not have training in this area, but what we're really seeing is huge strides. That said, there's a lot of work to be done, as you all probably know. Most places, you can't call up your health insurance company and request someone who has training or experience in gender, though Kaiser Permanente is actually changing that. Most systems in medical and mental health institutions just aren't set up to search by the criteria of transgender health or training and education in gender, because trans health hasn't really been institutionalized or recognized as an area of specialty care unto itself. It actually typically falls within endocrinology, plastic surgery, adolescent medicine, internal medicine, or mental health. But the catch is that most people who go into those fields don't necessarily receive training in gender affirming care. So finding an endocrinologist doesn't necessarily mean they'll know how to administer hormones. Does that make sense?
Yeah, no, that definitely makes sense. And it's something that I experienced when I started reaching out to my insurance company early in my transition as well. At first, my company did not have someone dedicated to trans health concerns. And I was largely left in the dark as to what procedures were covered and which ones weren't. Although I had a copy of my policy, the policy as it was written contradicted itself, where in one location it said that certain procedures were allowed, in another corner of the document it said that they were not allowed. Trying to find anyone at the company who was able to decipher this and give me a clear answer was almost impossible. It wasn't until about halfway through my transition that my insurance plan actually brought on somebody or trained somebody to have a focus in their transgender coverage, which was very helpful when that came into play. But as you mentioned, this is still relatively a new type position for insurance companies. It wasn't something they really focused on. You were lucky if you found the one person at the call center who had experience dealing with it in the past. And my experience prior was being bounced around and around and around until I did find that one person who could answer the questions that I had. So it's good to hear that progress is being made there. It's also good to see the progress that's being made in some of those non-governmental organizations like the WHO, WPATH, and redefining what it means to be transgender and redefining the scope of these diagnoses as well. But that's sort of in conflict with some of the recent news here in the US. HUD's proposed rollbacks, the new HHS proposal. What stands to be the impact of these proposals for trans folks in their day-to-day lives?
It could definitely lead to more anti-transgender discrimination. Trans folks' day-to-day experience will likely vary depending on their geographic location. For instance, some liberal states will continue to abide by state laws regardless of what happens with these rollbacks. But in states that don't have specific protections for trans folks, the rollbacks will grant people and agencies the right to legally refuse housing, care, and coverage because being trans, queer, or having had an abortion is against their values and beliefs, which is incredibly disturbing. But it's important to remember that as of now, the healthcare rights law is the law of the land, and most courts have said it protects transgender people. When it comes down to it, only Congress has the power to change the law by repealing the Affordable Care Act. The Trump administration actions are meant to win anti-trans votes and cause confusion for many patients, providers, and insurance companies, but as of now, it has not changed the law.
Mm-hmm. Yeah, I think it's, for me, I keep having this frustration. You see the same thing that's happening with all of the state level abortion laws and legislation that's coming on board, where these things happen, but they don't go into effect, but they have the effect of people misinterpreting the law, right? So people thinking that, that these things are no longer available. And you see abortion clinics and providers and funds trying to urge people and educate people that no, like these things are still available. And it feels like a very similar scenario with a lot of the proposals that are happening now. Like you said, so many of these things are at the proposal level, but it's a real threat in reality, especially if you think of potential emergency situations. If you're going into an ER and if you run across someone who's miseducated, a provider, a nurse, or an EMT that's miseducated on the subject, or is just blatantly discriminate in the first place, because we know that even with these protections, the discrimination obviously still occurs. But it when time is of the essence, that these are the things that really scare me. So I think it's super important, like you're saying, to get the word out, that the education around what is actually happening, what's a proposal, what's a law, where do we stand, and it's all very confusing and overwhelming. Just to add to your plate,
You're absolutely right, Thomas. Yeah, you're right. And we as trans folks have to educate our own providers far too often already. Too many members of our community have to pay out of pocket for medically necessary surgeries and medications. And so one of the things that I really think about when it comes to improvements in medical care and mental health care is institutions need to systematically find ways to acknowledge between the difference of sex and gender, and really understand that neither one is binary, and to make those options available on forms and records. They also need to recognize that opportunities to increase inclusion are everywhere, from patient interactions to signage to documentation practices. Trans and non-binary people will continue to face discrimination or feel uncomfortable in healthcare settings until we assess the ways the medical system really perpetuates the erasure, exclusion, misunderstanding, and mistreatment of trans people.
Yeah, I mean, we already know, we all know, probably from personal experience, just how hard it is to go to the doctor, to ask for the care that you need, and to feel, I feel like we've all been there. Even when Samantha was talking about calling insurance companies, I was my heart was racing, remembering having to make those phone calls and how vulnerable it felt to be outing myself, even on a phone call, to say, I need this information. And so there's that aspect of the limitations of the healthcare due to perceived discriminations and fear. But we also talk a lot in the community at large, really, around the word gatekeeping. We hear that being thrown around a lot. And I was hoping that maybe you could define for us what gatekeeping means, and how it manifests itself in the trans healthcare realm, in terms of the care that we receive and the care that we don't receive.
Yes. So gatekeeping is really the idea that a medical or mental health provider is in the position of granting access to identities, medications, or procedures that a client or patient wouldn't otherwise be able to access validly by simply asserting themselves and their needs. So the most common example of this comes up when policies require that trans people be evaluated and diagnosed by a mental health provider before getting medically necessary surgeries and medications. And the whole problem with gatekeeping is that it reinforces the notion that providers know more about trans people and what they need than the trans person themselves. And then it becomes even more complicated when a trans person doesn't fit the provider's stereotype of what a trans person should look like or live like. So it's quite a complex topic, but something that mental health professionals and medical providers are talking more and more about, hopefully openly, with the trans community.
And that is one of the more common times I hear about people being in a gatekeeping type situation, is when maybe their presentation isn't binary, or they don't meet the requirements that a caretaker has in their minds of what it means to be trans. And sort of a personal question for you, Meir, do you find that non-binary individuals are more likely to be discriminated against or more likely to be gatekept when starting their transitions?
Definitely. And I think that non-binary individuals are also readily able to oftentimes present themselves as more binary trans than they actually identify as, just in order to get access to medications that they know that they need. And so I've have a number of non-binary people that I know that really have known the only way they can get access to hormones is if they say they want to fully transition. And so they go into medical transition knowing like, I'm not going to be able to be honest with my provider, or I might not get the care that I need. And so I think more often than not, especially in places where there isn't readily accessible information about non-binary identities, and there currently aren't really guidelines for non-binary treatment, it really is on the patient themselves to advocate. And that's a lot to ask for a person, especially in a medical setting.
Yeah, definitely. Now, Meir, you are a licensed clinical social worker. You provide counseling and therapy to those in need. Let's talk a little bit about the state of mental health care for trans individuals. How are mental and medical health care concerns intertwined? And what have you done, or what have your experiences been like as part of this care system, both as a provider and a patient?
The experience as a provider and a patient has been drastically different. Mental health providers are some of the folks fighting the hardest for positive changes and greater access for the trans community, but historically, they are also some of the people who have hurt the trans community the most. So when I was thinking about going into clinical social work, I actually really struggled with the idea that I was going to become some of these gatekeepers. I was going to become one of in the field of folks that were really hurting the transgender community and not helping them move forward. And so I think it's really important that everyone as a mental health provider who's doing work with trans individuals really think about the history of how they got to be in the position that they're in. That said, there have been some really great strides in mental health care right now. 17 states have laws banning conversion therapy. While that's great, that also means that 33 states do not. And in 33 states, that means it's illegal for a mental health professional to attempt to try and change someone's sexual orientation or gender, which is terrifying. But that's not to say that there aren't some really affirming and experienced counselors in those states. It's just hard to find them. And that's why our community is more accustomed to relying on word of mouth referrals and advice from the inside. But I'm also part of a number of statewide and national networks of gender therapists or gender affirming therapists. And we are all always communicating with one another, trying to connect people with the care that they deserve, knowing that more often than not, when they walk into a random office, they're not going to get that.
Yeah, and it brings up a lot of memories of like having to go into, one, find like a therapist and a provider who had some experience with like what I was going to need in terms of like letters and things for surgery, but then walking into the room and knowing, like you said earlier with the gatekeeping, that I'm going to have to kind of guide them with what I say. It's a weird mixture of like walking this like untruth, like I'm not lying, but I'm like trying to say the right things so that you've diagnosed me in the right way and so that I get what I know that I need. And it's just all so very frustrating. And I can only imagine the back and forth that you've had to experience too personally from the patient side and the provider side. And that the fact that you had that awareness of going into your career, thinking about, the gatekeeping and the difficulties that are going to come with that. I mean, I think that's a huge asset. I mean, I think that's so great. I know it probably created a lot of anxiety for you personally, but to know that there are providers out there that are actually actively thinking about those things and understand this at a very personal level, I think is so incredibly valuable. But it all kind of also ties into what we talked about earlier in the show with some of the news. And we mentioned how the World Health Organization has reclassified this gender incongruence, the term that is used to describe people who are trans, and how this is no longer considered a mental disorder. So can you tell us a little bit about the classification system or anything that you know about it, and how the World Health Organization uses that and the impact that these changes might have for people like on the ground?
Great question. So the World Health Organization uses what they call ICD codes to convey different medical or mental health or other issues that someone may come in with that is related to their health. And previously, gender dysphoria or gender identity disorder or gender incongruence, all the different various diagnoses that have been imposed upon trans folks, have lived in the realm of mental health. And the World Health Organization did a wonderful thing in acknowledging that it's not a mental health issue, it's actually something else. Now, they placed it in sexual health, and my guess is they placed it there because there wasn't a better place to put it at this moment in time, because again, we have not developed this institutionally, academically recognized area that I'm actually calling gender health, which is similar to sexual health, but it's related to gender. And everyone has it, and everyone has different needs around it, just like straight people have them, cis people have them, trans people have them. And so what I would guess is that it's living in sexual health now, and that sexual health is going to expand to include more elements of gender health.
Yeah, I think a system like that going forward would be very beneficial. So we have talked about a lot of difficult topics here tonight, some of them disheartening, but it does sound like at least the updated stance of the WHO will help broaden access to care for trans individuals worldwide, which is very encouraging. But Meir, are there other areas for hope? How can individuals who want to advocate and fight for trans rights get involved?
There definitely are areas of hope. Trans healthcare is really recognizing the importance of including trans identified people. On one of the research studies that I'm working on with the National Institute of Health, all of the folks carrying out the research on the ground with youth are actually trans identified. There are more and more medical settings that are recognizing the need to include trans voices in decision-making, assessment, evaluation, planning, and the same goes for the professional field of mental health. So we really are seeing this acknowledgement that cisgender knowledge, whether it's in the medical field or the mental health field, really only goes so far. And so one of the things that I'm really inspired by is the inclusion of trans voices and trans representation in healthcare and medical and mental health settings.
Absolutely, that's so huge. And just my experiences in meeting people in the community, I have met trans doctors, I've met trans psychologists, and it's wonderful to be supported or to have the opportunity to be supported by other people within the community. And I know that as time continues to go on here, we will see more professionals and more doctors and more social workers and physicians and nurses who are trans or are queer. And I think that it'll be very beneficial for all of us. So definitely want to see more trans individuals out there in these type of roles. And for the people that are out there right now on the front lines, you know, they're leading the way right now. They're the ones who are helping people understand and helping other trans people in their communities as well.
Yeah, I want a trans doctor. Like, that sounds awesome. Right? Sounds so good. But we do have some viewer questions. We actually have a lot of viewer questions that we definitely want to get to. So also, if you're watching live on YouTube, please if you have a question for Meir or Samantha or myself, put it in the chat and we'll try to answer as many as we can. But first, we have a whole string of submitted viewer questions from earlier this week on our Instagram. So the first one is, how do you think professionals can best support individuals as they explore their gender?
I would say the first thing to do would be listen. Oftentimes, in terms of my own personal experience, when I go into a space with a mental health provider and I disclose that I'm trans or I'm non-binary, they want to tell me everything that they know about trans and non-binary, and they want to tell me all the ways they are incredibly supportive, and they really often project what their idea of trans or non-binary is. And I think that is a huge mistake, because first, you also want to hear about what gender or trans or non-binary is to someone else, how they understand their gender. So before sharing any preconceived notions about what it means to explore gender, ask this person what it means for them. Listen, really use questions that are intentional and thoughtful, that get folks to think about, where did I come to understand this thing called gender? What are my beliefs about gender grounded in? And then from there, I think another big piece is education and providing people with all of the options. Because oftentimes I see folks really cling to a certain gender, a certain area of gender exploration, and there's a lot of other things out there that might also fit within that person's expression, identity, makeup. And so I would say listening, education, and options would be some of the best ways to support someone who's exploring gender, especially in the early stages.
Mm-hmm.
That's a great
I think
answer.
that's a really good answer. Yeah, for sure. I mean, like, it gets to me like when often medical care gets so clinical, like it feels often so cold. And especially, I mean, there are so many instances where it shouldn't be that way. And we could argue many instances of medical care shouldn't be that way. That's it's a very personal thing, because it's your body and it's your health. But especially in terms of these gender explorations, I mean, putting the person first, and like you say, listening to them and allowing them to express what they're feeling, and not assigning the like single narrative you may know about trans identities to this person's journey and what it's going to look like, can make such a huge difference. So I think that's a really great piece of advice for like medical providers and just allies in general. Anybody who's listening to a trans person come out or discuss their life and their journey.
Another thing I would say about that, Thomas, is really talking about the historical context of how we got here. I'm very, very upfront with folks that I work with that are exploring gender about how I'm not going to assume they have a mental illness, and I'm not going to impose this frame of therapy and mental health services on them, because that might not be what they came to see me for. They might have come to see me for education. They might have came to see me because they need a letter for surgery. They might have come to see me because they want to transition at school. But none of those things are truly therapy. And so it's always baffled me why we, quote unquote, treat trans people with therapy, when therapy wasn't necessarily designed to be the thing that helps trans people meet their goals.
Oh my God, can I just snap for that just a little bit here? There's so many conversations with people that are like, I didn't want to go to therapy. I didn't have this in my plan, but like I'm required to do this to receive my care. And it can be a really frustrating barrier to be shoved into a treatment for something when really you just want to get that piece of paper. And sometimes good things can come out of that therapy. And I'm a very pro-therapy person. I love therapy, but everybody's needs are different. And you can't just, start shoving people down the same roads. It's amazing to hear you say that. I think that's a super, super good point.
Yeah, I think this ties in really well to our next question from the audience. And that question is, what areas of trans mental and physical health care do you think need improving?
So many. So many. I mean, the reality is every part of trans medical and mental health care that trans people show up in needs improving. Like I said prior to this, sometimes gender clinics or gender affirming providers are the only people that are really doing the work that needs to be done across all of healthcare. We really need, forms when you go into your emergency room that ask someone, what was your sex assigned at birth? What was your gender? Recently, there was a case that came out of the Midwest of a transgender man who came into an emergency room with severe abdominal pain. And he had gotten all of his legal documents changed. So when he came to the hospital, they just checked all the male boxes, which is exactly what they should have done. And they should have affirmed him as a male. But because he was assigned female at birth, there's actually a chance that he could have been pregnant. But the emergency room did not pick up on that until it was too late. And this person actually ended up having a miscarriage in the hospital that was completely missed. Because these systems are not set up in place to really understand the complex and unique needs and systems that trans people navigate. So that's what I would say about the areas of healthcare that need improving. It really is some of the systems, some of the record keeping, some of the training and education, because providers often have really good intentions, at least I hope they do, but those need to be reinforced with some policies and systems that really encourage people to do the education they need, to get the education they need to do their job.
That's a great answer.
Yeah. Our next question I want to jump to is, are there any little known perks or benefits within the healthcare system that trans folks should be aware of? Maybe little tricks, the trade, or ways to advocate for yourself?
Yes. So the anonymous call is one of my favorites, which is anytime that I am going to a new healthcare facility, whether it be the dentist or the optometrist or anything, I will call the office and I won't say who I am, but I'll just say, hi, I'm, a potential patient and I'm wondering if your office has had any training around gender or has any transgender patients that they care for. Now, I do that for two reasons. One is because I want to make an informed decision about whether or not this is someplace I want to go. And two, any potential kind of trauma or harassment potential setting. So that's a little trick of the trade that I've
Cool. It looks like we have a little internet connectivity issue, but we are refreshing Meir so that we can get them back up here and discuss more of these questions. I think the anonymous call option that they were just discussing is a really cool thing to think about. I've actually never thought about doing that, but it makes a lot of sense to be able to see if your provider or potential provider is going to have any of that education, if they're going to have forms that are going to be inclusive for you. I think that's a really, really great thing to think about and to do. Do we have Meir back, or are we still working on it? Okay.
I think I'm back.
Cool. Seeing a little, there we go. Are you with us, Meir? Almost. The internet is a funny thing. Almost. Okay.
Back?
I just heard you, yes. Are you still there? Okay. Meir, can you hear me? Awesome.
Just fine.
Wow. Samantha, maybe do you want to take us to our next question and we can just can just jump back in from there.
Yeah, let's just keep going here. On to our next one. How do you deal with being around in the system, getting the help you need?
Persistence, I would say. Real persistence and knowing your rights as a person who has access to medical care or has health care coverage. That's what I would say one of the most important things is. Sometimes I actually provide scripts to folks on what to say to insurance companies or to doctors in order to get to talk to the right person. Like you mentioned, Samantha, finding someone who is actually informed that's going to give you the services that you deserve is the most important thing. And so that's why I oftentimes ask folks about their knowledge and experience in this area. And if they don't, I use that as justification and reason for them to give me to someone else higher up. Because as someone who, is a customer of health insurance, as someone who has the right to health care, I deserve to be working with providers that are really informed about the care that they're giving me. And so that would be one reason or one kind of way that I would advocate around getting bumped around. And then don't be afraid to ask for help with a lot of different things once you find that person with knowledge, because transgender healthcare is really interdisciplinary. It's not just medicine, it's not just mental health, it's also social work, it's legal, it's education based. So oftentimes folks that are knowledgeable in this area have a lot of knowledge in other areas too. So don't be afraid to say, this is another need that I have. Can you help with this? Or do you know someone else who has knowledge and experience in this particular area of transgender healthcare? But advocacy and persistence are the number one thing. Don't get disheartened if you have to call 2 and 3 times, if you have to send 5 to 10 emails, because really once you find that person who knows, in my experience, it's really been a true benefit because they will help you navigate the rest of the system.
Yeah, you have to be your own advocate when it comes to getting the health care that you need. And if you're on the phone with somebody who just isn't working with you, if you need to hang up and call again and try to get another representative there, if your current regular medical provider isn't familiar enough with trans individuals, you feel like you're not getting the care you need to find somebody else who's a better fit for you. We have to take those steps and those actions. And it's unfortunate, but a lot of us also have to, step up because we may get knocked down in this process. I know that, in my search for a doctor for hormones, I had a doctor walk out on me. And, maybe if I was somebody else, I would have taken that as a sign that, this isn't worth doing right now, or this is just too hard and just give up. But if you run into those roadblocks, you have to just keep going. You have to keep pushing forward. You have to find the people that will support you and will provide that support that you need. And that a lot of times within the community, there's a good resource for finding other doctors or endocrinologists who are out there. So we can definitely lean on the community in our area or online to help us find those resources. But, the big takeaway is we have to keep fighting. We have to keep moving forward.
Yeah, and like you said, Meir, like once you find that person, once you find that one needle in the haystack of doctors who is in the know, it can really open up things for you. Like I remember finding a therapist at my university clinic who helped me with some of my initial therapy and some of my initial letters. And he, kind of knew the little small clique of a world that was the trans healthcare community in the area, because they probably all kind of interact at some point or another, maybe different trainings and things. It's a small world. So once I found that person, he was able to connect me to a nurse practitioner who really helped revolutionize my relationship with my hormones and advocated for me in so many ways. And so that persistence, as tiring as it can be upon everything else, it can eventually pay off, especially when you find the right person who really has the right connections and the right network of people. So I think that's a really great point.
I would also say folks don't often rely on case management enough. Case management is something that is available to many people either through their health insurance or income plan. And a case manager's job is to help you navigate the system. And so oftentimes I will have folks come to me as a therapist and be afraid to ask me questions about how to navigate the system, or be afraid to ask me to help them do that because they don't think that's what I do. I'm a therapist. I talk about feelings and mental health and all of these other things. But really, case management is a huge piece of social work, and it's a huge piece of mental health care. Having someone help you navigate the system. These healthcare companies and these doctors speak a language that's intimidating. And unless you have knowledge and experience navigating this world, it's incredibly hard. I mean, it really took me years to feel like I even knew what to say to an insurance company when I called them up.
Mm-hmm. Yeah, such a good point. So let's take a look at our next question. It is, are all insurance plans equal when it comes to trans-related procedures?
No, they are not. They vary quite drastically, both in terms of what is covered and how much things will be. So I always suggest that people get on the phone with the insurance company and ask very specific questions about deductibles, co-pays, the cost of specific medications that they might need access to on a regular basis, because all of those things can vary across healthcare plans. And so anytime opportunity to choose a healthcare plan, it's really worthwhile getting on the phone or sending an email and saying, these are the medications I would be taking. How much would they be? This is a procedure that I'm planning to have in the future. If I selected this plan, how much would that be out of pocket versus how much would be covered? Because there is quite variability across plans, I would say.
Something interesting I ran into as well. I work for a fairly large organization, and we actually have multiple healthcare plans that are available to us. And what I found out is that not all of the plans that were available to me were actually equal in the trans healthcare that they provided. So if you're in a situation like that, you really want to read the fine print and make sure that if you have multiple choices for a healthcare plan, you are picking the one that has the best trans coverage as well.
Mm-hmm, mm-hmm.
Yes. And with the Affordable Care Act, among other things, whether it be, Medicare in California or Medicare in other states, you really can find out what is going to be covered and what isn't. And it's super important to be able to do that. And if you have medical needs that aren't covered, you can also make a case to have your insurance plan go out of network in order to get someone that has experience and that you want to be providing you care. It definitely is a fight. Insurance companies don't want to be sued ultimately. And so they want to make sure that you're getting care that wouldn't cause a malpractice suit. And so it's in their best interest to always connect you with someone who has training and hopefully will provide adequate care in that area.
Now, our next question here is one we've sort of touched on. So is there anything else we forgot with any tips when working with insurance companies? I know we've kind of talked about this one a little bit already.
I would say appeal, appeal, appeal. Insurance companies are often going to deny someone coverage if they feel like they can. And those denials are devastating for trans folks, just devastating. But I see a huge amount of success when people actually pursue an appeal with their insurance company. And so I would say really appeal, appeal, appeal. Put the energy into getting the services, the procedures, the medications that you know that you deserve, and make sure they're covered. And again, this is someone that a social worker, a case manager can help you with this appeal process. But things aren't going to change if trans people don't do the work to make sure that these decisions are overturned, because with each decision that's overturned, it's precedent for coverage. It's precedent for someone else down the road.
Awesome advice.
Yeah. Another persistent, you just have to keep being that persistent person. And yeah, it can be exhausting, but it's so important, not only personally important, but like you said, important for the entire community and people within that provider. So let's jump over to our next question, which is, what would you say to those concerned about losing the mental illness diagnosis with the recent World Health Organization recategorization that we talked about earlier?
I would say that I don't see gender being completely detached from mental health just because it has been reclassified in terms of an ICD code. There are a number of areas of health that are interdisciplinary, and gender health is one of those areas. There are medical components involved, there are mental health components involved, there are personal components involved, there are community components involved. And so I would say that for those who are concerned about that and concerned about maybe losing rights or access as a result of this change, that I envision that mental health care will continue to be a part of what's suggested if someone is navigating gender in some shape or form.
Yeah, but you're so in that way saying that it's more of a suggestion than a requirement. In the way I'm digesting what you're saying is that it's a broadening and an opening of the classification to be more inclusive. And like we talked about, for those who may not want to actively pursue treatment through mental health, maybe this now becomes a route for them and it's not something that they're forced into. Is that correct, Meir? Am I sort of understanding what you're saying there correctly?
That's exactly correct.
Okay, yeah.
I don't envision that this change will take away mental health services from anyone at this point.
Mm-hmm.
All right, on to our last question that was submitted through Instagram. And I love the way this is phrased. What has been the hardest part of your journey through, into, and out of gender?
What a great question. Tough one. I would say the hardest part of my journey is and continues to be navigating my own ideals and values and identification with gender and how that differs from the gender in the world. And I think that's something that I continue to struggle with and will probably continue to struggle with for the rest of my life. But, you know, ever as a young tomboy, I feel like I've always been at odds with trying to be myself and be in a world that has different ideas about gender. And the pain of that process and the struggle of that process has definitely informed decisions that I've made to take testosterone or to get top surgery and to come out to my family and change my pronouns and all of those types of things. So I would say the hardest part of my journey is really figuring out how to manage the discomfort that arises from the fact that, you know, I have a non-binary gender and certain ideals about gender that the world will not reflect or reciprocate.
No, I think that's
a really
great perspective from your journey, Meir. I think that's important for people to hear. For me personally, besides the first step, right? The first step of actually coming out, you touched on something really important there in that, for a lot of us, we have these feelings, we have dysphoria we know who we are, but once we actually start down this path, there's still a lot of questions that need to be answered. And it doesn't necessarily mean you're going to get them all right the first time you come up either, as you develop your identity and your presentation. And I don't know if it was the hardest part, but it was definitely the hardest to see out into the future, into what was going to come down the line there. So I think when I first started in transition, I really wasn't clear, where I would be presentation wise, or where I would fit exactly on the gender spectrum. So there were definitely moments in there where, you question yourself, you question your identity, you question, is this me? And whether it's an article of clothing or just the way you speak, or, there's hundreds of different elements that make up your identity, and having to work through those and, figure out who you are. It's a hard journey, but it's also a very fulfilling journey. And I think it's important to know that it's not necessarily a journey that is over at any point. You don't have to lock yourself into any one way of being or existing. And I think it's important that, even into transition, we keep an open mind for ourselves as to our presentation, our appearance, and all those other aspects of who we are.
Yeah. Yes, one of the things that struck me when I was starting my journey, and I went to go see a mental health provider because I had to in order to get access to things that I thought I wanted. They really expected me to be able to predict the future. It seemed like part of the criteria in order to take steps in my journey was to know what that presentation was going to be like, was to know where I was going to land. But that wasn't where I was. And I didn't feel that I needed those answers in order to take a step. And so I think that was a big challenge in my journey, is going through a period of time where everyone was telling me, you need to have the answers in order to take a step. And I said, what if I won't get the answer until I take a step?
It's incredibly powerful, and it's so relatable. And I think about it in my own case too, where I felt that same pressure from my medical providers. And when I first went in to see a therapist to start hormones, I wanted to start on a lower dosage because I really wanted to take my time with my changes and take it slower. And there was a lot of pressure against that. They really questioned me a lot as to why I wanted a lower dosage, and if I felt this sort of dissection of are you serious? You say you're a man, but you don't want to take the dosage that I'm recommending to you to be a man. And it was all very confusing and really, really scary. And in that medical setting to have to advocate and say, no, this is really what I want. And it doesn't mean I, am not doing what's right for me, or that I'm wrong. It just means that I'm figuring myself out as I go, and there shouldn't be any shame in that. And yeah, it's a challenging landscape to go through, but like Samantha was saying, it's incredibly valuable. I think if we have that space to go through it and to learn from it. And certainly, as hard as advocating for myself has been, it has helped me grow as a person immensely. It's all a very, very interesting and complicated thing to reflect on. Yeah. Well, let's jump into a live question. I'm going to read it to you because I have it over here on my other screen. So this was a question from the live chat, and this is from a viewer named Chris, and they are asking, how can I keep up if my insurance company, their insurance company is Capital Blue, if my insurance company will change their policy of covering trans-specific healthcare? So how can I keep up if my insurance company will change their policy of covering trans-specific healthcare?
I would say those are questions that you can ask periodically, and you should contact the insurance company. One of the unfortunate things about insurance companies is they don't really notify their consumers or their customers when they make changes. It's one of those things where you show up at the pharmacy and suddenly the pharmacy says, your insurance company is no longer going to cover this. So being proactive and reaching out periodically and saying, has there been any progress in this area? Have there been any changes to the policy X or policy Y? And be very specific. And then also give health insurance companies a deadline. Like, when are you going to get back to X? And really hold them accountable. But I would say that would be the best way to keep up to date on if there are changes being made in your health insurance plan, because they will not notify you. You are going to have to reach out and do that yourself.
Mm-hmm. Yeah, very important to note to do that.
Sorry, we have one other question from the live chat as well. This is from someone who identifies as transmasculine, and I apologize because I'm reading it here. But their parents were against them transitioning and forced them back into the closet. They're asking if we have any tips on staying sane or maybe easing their parents into allowing them to transition here.
It's a really tough one because, parental support and acceptance is, incredibly important and painful all at the same time. And so what I would suggest to this person, and what I would ask this person are, what are some moments where you feel most affirmed by your gender? What are little things that you do for yourself that feel like, I am caring for this part of who I am that no one else can see and that I'm not allowed to show anyone else? Whether it be, drawing on a mustache and just like standing in front of the mirror every now and again, or editing pictures to see what someone would look like with short hair, or ordering that piece of clothing online that makes you feel good, even if you can only wear it in the privacy of your own bedroom. But find those little things, those little moments that make you feel like you. And know that sometimes it takes more strength to stay in the closet than it does to come out. And it's what some people need to do in order to stay safe. But just take all of those little moments that you can, because those are the best. That's the best way to stay sane, feel like you're loving yourself, and also continue the process of developing who you are and what your gender is.
That is such good advice. Oh my gosh. I'm even reflecting, I mean, having the privilege of being out, I'm even reflecting as you say that a lot of my most valuable moments and gender affirming moments happen just one-on-one, me to me, what I'm doing and saying to myself, or the way that I can appreciate something about my body, or the way that I'm perceiving something throughout my day. It's often the most profound moments that I'm having recently are the things that I'm doing for myself when nobody's watching. And so I think that's a really, really incredible thing to say, is that you are valid as you are right now, whether anybody else knows it or not. And you can access that you right now. You don't have to have anybody know that to be who you are. You are you, and it's going to be okay. It's going to be more than okay. It's going to be amazing. And just living that day in and day out, and knowing that, you are you, and that you can validate that every single day, I think is just the greatest gift you can give yourself. And my cat just jumped on my lap, so here we are.
All right, so that covers our live questions that were submitted there. So Meir, I'd like to ask you just to hang tight for a few minutes here, because it's time for our ongoing segment covering trans representation in TV and film. Neela Karasik joins us now. Neela.
Thanks, Samantha and Thomas. This week, we're taking a look at a recent episode of Chicago Med. The NBC medical drama, which also airs on Global in Canada, features a recurring character who is trans. Played by trans actress Alexandra Gray, Denise has appeared in 2 episodes of the show so far, one this season and one way back in 2016. She plays the estranged sister of Maggie, one of the show's main characters. There were some things we felt they got right about this show, and a few things that could have been done a lot better, and even some things that we ourselves were kind of on the fence about and we're looking forward to discussing on the show. So without further ado, let's take a look.
Denise! Look at you. You look awesome.
The episode begins with charge nurse Maggie Lockwood meeting her trans sister Denise's new boyfriend Trevor.
I see good genes running the family.
While the smooth talker makes a good first impression,
He's a keeper.
we quickly learn that Trevor is not what he seems. Denise suffers a busted lip and faints,
Denise?
and we later learn it's because she hadn't been eating enough.
Denise? Denise?
And now her sister Maggie has some tough questions.
How long has Trevor been putting his hands on
He
you?
hasn't. He just lost his temper today. It's my fault. I was pushing his buttons.
Denise is clearly the victim, but somehow she seems to think it's her fault.
You know, I don't expect you to understand, okay? Look, Trevor may not be perfect, but at least he loves me for me.
Loves you? This man doesn't love you.
When confronted by Maggie and her coworker,
Come near my sister again. Respond to a text, answer a phone call, and I will call the cops.
Trevor shows his true colors.
Just done with that freak anyways.
So here's what we liked, didn't like, and we're kind of unsure about with this episode. We'll start with what we liked. First, the actress who plays Denise, Alexandra Gray, is trans herself, and it's always great to see a trans person playing a trans character. Secondly, there was this moment that we loved.
Probably a dumb question, but does she date men or women?
Oh, well, every trans woman is different, but Denise dates men.
Where the distinction between gender identity and sexuality was lightly touched on. Now to the things we didn't like. First, we would have loved to have seen this character develop further. As far as a patient goes, she got a fair amount of screen time, but we were kind of just left wanting more. But the bigger problem was that this character once again portrayed a trans woman as a helpless, irrational victim who can't take care of herself.
My sister needs protection from that monster.
And she has to be placated and head patted like an infant because she can't handle the truth.
He said you meant a lot to him.
The one thing we were torn on was how we felt overall, whether this character was kind of a played-out stereotype of a trans woman of color, or whether it accurately captures how they're often the victims of violence. Anyway, that's our take on the episode. We want to know what you think too, so leave your thoughts in the comments so we can all discuss. With that, Samantha and Thomas, I'll send it back to you.
Thanks, Neela. I think it's interesting, Samantha. I mean, I think there were some things that were done really well in this clip, and like Neela was saying, there are areas where you could have gone deeper, and you wanted to see a little more development in the character. And specifically, I think, showing that this violence is occurring against women of color, trans women of color, I think is incredibly important, but it wasn't really, to me, it wasn't like hit home totally in the grand scheme of the episode, because it wasn't like compared across any other differences. It was just, the story was given, but it wasn't stated that this is a major issue, ongoing issue for trans women of color. I mean, what do you think, Samantha?
Yeah, I think you're right in a lot of ways there. The story is very thin overall in this episode. At least the episode with the trans character, or the timeline or story arc with the trans character, is a little thin. But there is a lot of stuff that I do appreciate. It's really nice to see in a drama like this, which you look at medical dramas, you look at police dramas. These are the kind of dramas that traditionally only cast trans individuals in very negative lights. So it's really great to see Chicago Med, one of these big dramas, actually casting a trans individual as a human being, as a sister, as somebody who isn't just in a body bag or a sex worker or anything like that. So that I do appreciate in the episode. I also appreciate that they are trans themselves, which is something that we traditionally haven't seen in a lot of TV dramas, but something we are seeing happen more and more lately. So overall, although it's thin for a storyline, I thought they did a good job. I did, and I'm really curious to hear what other people who saw the episode think about it as well.
in the comments to this episode and on Instagram. Let us know what you think. Hit us up. Neela, I'm sure will be in the comments as well, talking back and getting everybody's comments in. So with that, let's talk about next week's episode. Our guests will be Dakota Pierce and Blair Shelstein, one of our all-time favorite trans couples out there. We will be talking with them about life, love, and relationships. So we hope you'll join us here next week, same time, same place. That's 7:30 p.m. Pacific, 10:30 p.m. Eastern, right here on YouTube and Facebook.
Oh my gosh, they are such a beautiful couple. As a reminder, if you'd like to get notifications when we go live, don't forget to subscribe to our YouTube channel, Trans IRL. All of our past episodes are available there as well. We are also on Facebook as Trans IRL Show and Instagram as Trans IRL. So don't forget to like and follow us there as well. We covered an unbelievable amount of topics and questions here tonight. I think this is a really important conversation to have, and I want to thank Meir for joining us again.
Thank you.
Yes, thanks, Meir. It was such a fun convo. I just love talking all the ins and outs of insurance and healthcare with you. It was a great time.
And I'd like to thank Neela for her contributions here this week, and Addison in the Trans IRL control room. From all of us here at Trans IRL, have a great night. We'll see you next week.